So this is a bank holiday in May, and I'm here with Scott Nimmo, super vet, to look at his wonderful equipment. Now, it strikes me that if I need a chest x-ray when I'm living and working in or near South Woodham Ferrers, I've got to go to Maldon or Broomfield to get it. If one of my labs needs an x-ray, I'll bring it down here.
Yes, I'm afraid that's the case. We've recently invested in this setup here, which for a vet I suppose is state of the art, but we do x-rays every day of the week in fact, and yes, you would get an x-ray taken within 10 minutes perhaps, and you get some sort of an analysis the same day.
Right, well that's just wonderful. I mean, what sort of cost is involved in this sort of equipment here?
What you're looking at here, the whole setup including the processor is about £20,000.
Right.
I don't truly understand the ins and outs of it, but this is an X-ray generator as opposed to the old-fashioned tube.
Yes, right. This is the gadget down here, is it? This one, that one there?
That's the cutting edge of it, yes.
Right. Okay. And that produces good quality X-rays?
Absolutely excellent quality X-rays.
Right.
Sometimes we send the X-rays for referral, and with our previous machine, sometimes the consultants were quite hard on us, and they said the quality of the x-rays was too poor for diagnosis.
Right.
But having invested in this, I have no problems. It produces really first-class x-rays. I can put some on the screen later and let you see, in fact.
That would be excellent, yeah, sure. So, I mean, if you're sending them the consultants, do you have to digitalise them? Or?
Well, I find I take a picture with a fairly good digital camera, and that's good enough, yes. Unfortunately, we don't have a digital processor. Right. Because our throughput is about 3 plates a day. Right. And the costs of it just aren't justified, I'm afraid. Yes. The digital processing is in its infancy for vets, and it's just so expensive at the minute. So we use a good quality normal processor. We either put the film in the post, but I can take a picture with a digital camera, and that's really almost as good.
Is it? That's fine. Now, I mean, is this a vet x-ray machine, or is it a human x-ray machine that's used for veterinary purposes?
This is a human x-ray machine which has been rebranded.
Right.
Yes.
So that would do a perfectly good chest x-ray?
Yes, absolutely. And our one has got really sufficient power to do, well, any person I would have thought. We can certainly do Great Danes. Right. Power to spare, yes.
Oh, well, that's excellent. I mean, what are the practicalities of that? I mean, I did hear of a guy who was a vet in London who used to hire an imaging suite in one of the big private hospitals for his clients. Now, presumably there wasn't a risk of cross-infection there. What would be the case here if it was, say, the other way round and we were sending our patients here, assuming that it was approved, assuming there was a radiologist available?
I personally think there would be very, very little risk, and the reason is because of a concept called the species barrier. Right. When I do surgery here, we get very, very few wound infections, and we get very few post-operative infections of any sort. Yeah. I don't catch anything from the animals, and the animals don't catch anything from me.
Well, it was not so long ago people were operating without gloves, wasn't it?
Yes, absolutely.
And you didn't have any MRSA? Or?
No, we don't. We've got. I do the clinical audit for my organisation, and there's 0 post-operative infection. Not because of any great skill on my part, but because of the species barrier. The bugs, the bacteria that are on me certainly don't seem to affect the dogs, or vice versa. Now, I'm not saying it would be a good thing, but if you were to get a radiologist to come here and to x-ray their patients, it's highly unlikely to catch anything from the animals. It's more likely, in my opinion, to catch MRSA from the local hospital, judging from the headlines I see in the press.
Yes, indeed. I mean, for operations now, you scrub up and you wear gloves and stuff.
And we have a good quality operating theatre. Yeah. Even so, I sometimes speak to my junior colleagues about the hygiene, about their operating standards. Yeah. But I know we could get away with a lot less because of the species barrier. We are not going to affect our patients, and they're not going to infect us.
Splendid. Okay, just quickly show me this wonderful gadget and what bits are what, so we can have a look. And tell me about screening. Dentists don't seem to have an awful lot of sort of lead lining and the sort of stuff that the bureaucrats always
take an X-ray, we're not even in the room.
Yeah.
What we do is, on this clip here, which isn't on at present, of course, there's a portable anaesthetic unit. In fact, I'll just pop it on, it just takes a second.
Okay, alright. Oops. I'll follow you around because I want to, as we do, I want to just look at your little, this is your dirty operating.
Oh yeah, this is a prep room, a dirty area, yeah.
And that's where you do your sort of abscesses and dental work, I see. You've got a little dental machine down there?
Well, it's not a very good one, but
it does the good. Oh, that's a nice ultrasonic scaler.
And it's got a little drill.
Wonderful. And you're, oh right. Anaesthetic gear. While you're doing that, I'm just going to have a quick look at your pucker operating theatre, which has got piped gas, operating light. That looks pretty good to me. Back through the dirty area here, which is where you do the scalings, and on to your anaesthetic unit here. Oh, they have to be put out, obviously.
I'll show you the rest.
Right. While you're doing that, I'm going to be looking at this, which looks like an ultrasound. And very nice that is too. So really everything here that one would need. This is an ultrasound machine here.
Yes, it is, yeah.
Wonderful. And there's that sort of, that looks state of the art. New?
It's not quite state of the art. It is state of the art for a vet.
Is it?
But this costs us, I think £9,000, something like that.
Right.
But the ones you guys have will be a lot more expensive. Yeah.
Not always. No, not always. The prices, I think, are coming down. So, okay, this is the.
So basically, when I X-ray an animal, what's going to happen is the animal's going to be knocked out.
Yeah, put on there.
And for health and safety reasons, I'll be nowhere near it. I shall be behind this wall here,
sure,
which we've had tested.
Yeah. All right.
I'll turn the setup on, which means none of my staff will be nearby.
Yeah.
And I will press the button from this position here.
Okay. So
that's our health and safety angle.
Right. And that being a modern machine, there's very little scatter.
None. No. Well. You say none. It's serviced on a regular basis.
Yeah.
It's only a year old, so it's just had its first service.
Sure.
But they put plates at strategic points and they check for scatter.
Yeah.
Scatter will be at a minimum because of the construction of the table.
Yes.
And the plates on a special holder underneath.
Right.
Once the animal's on the table, we can move the table to wherever we
Oh, I
like.
see. Oh, right. That's wonderful, isn't it?
Let's turn it on for you.
Splendid.
Turns on from here, of course, doesn't it?
He's turned it off again. That is splendid. So the ultrasound you can use for anything and everything?
I'll show you that working.
Okay, well I'll tell you what, I think we'll break there, having done the x-rays, and I'll move on to the ultrasound. Thank you very much.
I'll put my head on.